there's just so much.
You're listening to a Mamamia podcast.
Hello and welcome to the brand new era of Well, the podcast for your health and body explained. I'm Dr. Ginni Mansberg. I'm a GP and a women's health expert. And basically I'm here to talk about the annoying, the embarrassing and the scary when it comes to women's health, because chances are I've heard it, I've seen it, I've smelt it, I've touched it, and I've definitely treated it all before.
And I'm Cath, Mahoney, a comedian and an author. I always have crystals in my bra and I like to bring the woo-woo because I love shocking Dr. Ginni with the things I've bought online, the wellness supplements and the occasional psychic reading.
You just keep me entertained. I love it.
Oh, I love it for us. I've got some crystals for you in my bag. Right. Okay. So what are we discussing today? Well, we are tackling a topic that is practically buried under a mountain of fitness myths and honestly takes up a lot of our emotional energy. Belly fat.
Yeah.
Surely I'm not alone on that one.
Definitely not.
And we're looking at what you can do if you're one of the 1 in 3 women who experience migraines.
So common.
That is me.
Yeah.
And then we're unpacking your awkward, asking for a friend health questions.
Yes.
Even though we really know there is no friend.
She's a myth. But first, it is time for What the Health, your quick dose of women's health headlines.
How are you? Well, how are you feeling?
Are you well?
Are you well?
Cath, I've been really blown away by this growing trend of getting women to ask their doctors about having their tubes removed, not tied, but removed for the sole purpose of preventing ovarian cancer, which is one of those cancers that just perennially scares the you-know-what out of women. They're absolutely terrified of it because it's caught late, there's no symptoms. It's really got a bad prognosis. And studies have found that often they seem to start in the tubes and spread up to the ovaries. Oh, and when I say tubes, I mean fallopian tubes, the ones that carry the egg from the ovary down into the uterus.
Got it.
And if we remove your tubes, just as a preventive thing, we just take them out. Let's say we're going in there to do an endometriosis cleanup or we're going to take your appendix out. If we remove your tubes at the same time, studies show we can prevent up to 80% of ovarian cancer. So if
80?
if you're vulnerable, this is worth chatting about with your GP if you've never talked about it before. It's a whole new thing that I've been really fascinated by.
And we're talking about post-children?
Well, you're not going to be able to conceive a baby naturally if you don't have tubes. Those tubes are essential for conception. But if you've done with that, or if you are going to get something like pre-genetic testing anyway, like you are not going to go via the tubal route anyway, then maybe it's something that you could at least discuss with your doctor. Ovarian cancer tends to happen to older women anyway, so it's unlikely we would be doing it to a 20-year-old. But there are women who are at very high risk for genetic reasons. Maybe they have conditions that put them at high risk. It is not for everyone, but it is definitely worth having a conversation with your doctor about if you think that's something that you would benefit from. This is gaining momentum. There are far more gynecologists bringing this up with their patients and doing this surgery. It's not mainstream and absolutely everywhere yet, but I think it will be.
So watch this space.
Yeah. Cath, grip strength is one of these things that just keeps coming up in study after study, showing that it's like a predictor of how long you're going to live and how healthy you're going to be into old age. And like so much of me is just tempted to go, that is just the biggest load of baloney I've ever heard, except that every single study shows the same thing. So what I don't know, or what researchers don't know is it just like a proxy for your generalized strength? Like, is it sort of, if you've got a strong hand, you also have strong gut muscles and strong leg muscles, or is there some special magic in the hands? At this point, I'm not going to say like do jar opening exercises and like go to the gym specifically to work on your hands because that's the best way to live longer. But if you are somebody who thinks that your health is really bad, but you are awesome with a handshake, you might actually have some really good news on your side here.
Ooh, so rock climbers are going to live a long time. Okay, Dr. Ginni, over to the internet and what I found for us to discuss this week. Olive oil and bone broth. I'm asking the question, do viral gut health foods actually work or are they just filling my algorithm? At the moment, I'm seeing like chia seed water, sea moss gel, bone broth are all being promoted as ways to improve energy, mood and digestion. But scientists say evidence for many of these claims are limited.
Yeah, I mean, that's exactly right. We don't know that they don't work.
Yeah.
We don't know that they do work. The studies haven't been done. And it is really hard to fund a study that does not have like some commercial interest behind it. But gut healing or gut health is not a bad thing. What they're trying to do is nurture good bugs to grow within your guts that do really good things for your immune system and actually put out really interesting hormones that affect your entire body. We don't know that any of these particular viral trends do that more than, let's say, a Greek salad or some wok-fried vegetables. We don't know. So if you love a sea moss gel, you do you. I'm very happy for you. If you love a bone broth instead of a cup of tea, all power to you. For the rest of us, just keep eating the healthy food.
I don't mind a bit of bone broth, but I think
commercial one that you buy, or do you make your own?
Oh, gosh. I mean, I barely make toast. No, I definitely buy it. Okay, up next, we need to talk about belly fat. We're breaking down the massive role that chronic stress plays and why losing abdominal fat has way less to do with calories and way more to do with your hormones.
How are you? Well, how are you feeling?
Are you well?
Are you well?
All right, it is time for Are You Well?, where we unpack the most important conversations that are happening in health right now. Now, first up today, Cath, I'm so excited about this because we're going to talk about the thing that is so distressing to my patients, like to a woman, and that is the belly fat. They are saying, what is going on with this? They are pointing to their bellies. And to a woman, they're really worried about, even if they haven't stacked on kilos, the fact that they're thickening up around the waist. So I thought we could talk about exactly what belly fat is and how it differs to the jiggly stuff on your thighs.
Me and my tummy are all ears.
Okay, Cath.
Yes, tell me.
Ready? There are basically two types of fat in your body. The belly fat is also known as visceral fat. So what you see is actually only part of the story, because actually most of the fat is sitting around the organs that are inside your belly. So things like your liver, your pancreas, the guts themselves now start to get coated with fat, and that expands your waistline. So it's not what's sitting under the skin, it's actually internal. And what's really important about this is that that fat behaves differently inside your body, emitting all of these crazy pro-inflammatory chemicals that actually wreak havoc throughout the body, including your brain, your immune system, your heart. It's wild.
Different to the fat on like my inner thigh, under my arms.
So we call that your subcutaneous fat, that wobbly fat.
Yeah.
Actually, it doesn't seem to secrete any of those nasty adipokines, those hormones that are secreted by your visceral fat. And in some studies, it could even be protective against some of those chronic diseases that are driven by your belly fat. So actually, if you see a wobble on your bottom, welcome it, because it actually could be good news for your body. But we do need to talk about that belly fat, because that's exactly what you don't want as you get older and you're looking to prevent those chronic diseases.
Okay, so tell me, how are we going to stop it?
Okay, so think of your belly fat and all of the chemicals that it sends out into the body being in competition with your muscles, and all of the chemicals it sends out into your body that are anti-inflammatory. Build your immune system, build parts of your brain that prevent like falls, like help your balance. It's wild how much those myokines, the muscle-derived chemicals, actually do. And the more muscle you have, the more antagonism you get of the adipokines coming out of your belly fat. So in that war, muscle is the winner. We want to actually have more resistance training to actually combat that and build your muscle, and actually can reduce your belly fat as well. In terms of your food, your enemy is your highly processed carbohydrates. Though anything out of a packet, those things, and like soft drinks as well, seem to really drive your body's ability to make belly fat. So they are like now off the menu, like as if we haven't talked about that enough on this show. But like we have to really drive that message home. We want more protein, less stress. Like that's easy to do. And cardio, like your aerobics, your running, it's going to help, but it's not as much as you think. It's actually your resistance training is going to do more.
Really? So so I should not sign up for a marathon. Is that what you're saying?
Oh,
good job. Okay, not signing up for a marathon.
Oh yes, you and I. Sorry, wink, wink. Yes, we definitely don't want to be doing marathons. Well, if you love marathons and you're a listener to this show, we are so in support of you. But for the rest of us who like couldn't think of anything worse, it's fine. What we can do is go for a walk, a brisk walk, for half an hour a day, but we've just got to do like probably 1.5 to 2 hours a week of that resistance training to build up those muscles.
So resistance training is literally going to do more for my tummy than
Isn't
the
that
cardio.
wild?
Yeah,
Yeah,
I
'cause
thought
I
you
see
shredded when you did the cardio.
I always think of shredding that, and
Yeah.
I think that certainly happens when you're younger. But as you cross over the threshold
Yeah.
into menopause, you just get this tendency to accumulate the belly fat, that fat around your organs, and that's what we've got to really be going to war against.
So why, as we hit menopause, does it sit around our tummy more?
We don't know. Like, we assume it's to do with estrogen, and that estrogen puts wobbly fat onto your bottom and stops it going onto your organs, but we don't know that for sure. We're just assuming it.
What about my crunches that I don't do? Are they helping?
All the crunches you don't do are not
my
helping.
crunchies that I eat, my crunches and my ab work.
So I think we can say a solid no on the exercise you
Okay.
don't do, but
Yes.
any exercise that you do that is like resist, because crunches are really good for resistance. So are push-ups. They're all a yes. We're a hard yes
Okay.
on those. So's your Pilates class. That's great.
So basically, no bad food and more exercise.
Well, when we say no bad food, let's just say let's minimise that.
Okay.
And none of us in this room are wearing a halo. That I can promise you. It's just more good, less bad is going to be the motto of Well from now on in.
We're going to get henna tattoos with that on?
Oh, yeah.
Yeah. Maybe a coffee mug.
Bit of merch.
Yeah. Up next, we need to talk about migraines. What's actually going on in the brain when they hit, and why they are a lot more than just a bad headache.
Okay, moving on now. And in our next Are You Well, we're going to talk migraines.
Something close to not my heart, my head. Let's go.
So, Cath, you are a migraine sufferer.
Yes, I'm a card-carrying migraine sufferer.
How often?
Oh, I feel very hormonal. It was sort of around my periods, and then when I was pregnant, and now I think I've got some as part of my perimenopause mix.
Yeah, they often go up in peri, mainly because you're having hormone swings, and hormones are such a driver of them.
Okay, so I'm all across a migraine like a hot chip. For our listeners who aren't, what is the difference between a migraine and a headache?
It can be really hard to tell. For the 1 in 3 women who do get migraines in Australia, isn't that number just ridiculous? It is a severe headache. And the classic stereotype is that it's one-sided, that it comes on really suddenly, that it comes on with like some warning signs, maybe some blurred vision or smelling something weird, and you can't tolerate bright lights or really loud sounds, and you often want to throw up or even do throw up. In my experience, what a migraine is a headache that is so severe that you cannot just get on with it and take a couple of Panadol. It's a really nasty, nasty headache. And that's going to make a lot of listeners go, oh, that could be me. A lot of my patients have never been told they've got migraines, but they've been missing work because of headaches for years. And that is a migraine. That is exactly what a migraine is.
Okay, so what actually causes them?
Honestly, we don't know. It's interesting you were saying that a lot of your family members have them. It so runs in families.
So it does, okay.
Yeah, for sure. And I see women with migraines getting much worse around peri, but often their kids are coming home from school with really debilitating headaches. It happens in kids as well. And that's something worth knowing about. What is really easier to decode is what are your triggers. So hormones are the big one.
Yeah.
But for a lot of women, it's stress, it's missing sleep. Again, that's so bad in peri. It's like skipping meals can trigger a migraine. Some people have like chocolate or red wine. If you know what your triggers are, and sometimes you need to do a headache diary, but if you know what they are, you've got a better chance of staying on top of it and heading them off at the pass.
Yeah, I mean, for me, it just seemed to be hormones. There was no kind of other trigger, but it was just like bang. And you're out for the count.
Yeah.
Okay. For those listening at home who think they might be having migraines or do have them and want to know more, what do we do when we feel one coming on?
So I think the first thing to do is to check in with your GP, maybe with a headache diary, so you can see what patterns you're looking at. If it's always coming on before your period, if it's up and down like a yo-yo but you're in peri, that's very, very valid. I also want to know what time of the day they're coming on so we can try and help you plan for this. There are medications that we can get you to start on, and sooner is better than later. It's much easier to head off a migraine before it's at its most severe than once that horse is bolted. So early on in the piece, take either some sort of over-the-counter painkiller, a non-steroidal anti-inflammatory drug, even something like an ibuprofen or a paracetamol, if you can do that early. And you can even get these specialised migraine treatments that are called triptans that help control the way your blood vessels work during a migraine. You can get those over the counter. It's more expensive than getting them on a script, but if you can tell your GP, I've tried these triptans and this worked or it didn't work, that can really help us decode what's going on with your headache. And even if you have a tension headache, which tends to come on at the end of the day and feels like a tight band around your head and is not so severe that you feel like you need to go home, they can trigger migraines as well. So really take a note of that and go to your GP with that. And then we might try and help get you some preventers. So there are different things that we can prevent it with. There are certain medications. And if you meet the criteria for chronic migraine, this is really important.
What is a chronic migraine?
So the definition of that is that you have 10 days a month with a headache of some sort, 8 being severe enough to be that's a lot, but it's more common than you think. Then with that, if that's happened for more than 3 months in a row, you are now eligible to go to a neurologist, a specialist, and get there's a whole raft of migraine preventers out there. Everything from Botox on Medicare. Insane.
Really?
31 different points around your head and your neck. It's not meant to relax your neck muscles. It's actually meant to control the nerves that stimulate and actually cause a migraine, through to these new injection medications that can prevent migraines and actually reduce them by half or even more. So those headache diaries are worth gold because it can tell us more than you think. Most of my patients underestimate their migraines. They're not being hypochondriacs. They're quite the opposite.
I mean, I've suffered from migraines since I was 10. I had no idea of half of that stuff. That's incredible.
Yeah, I think my passion is that more women come forward and get treatment, because I think too many women are actually just sucking it up.
Yeah.
And I mean, so many of my patients don't even realise that their headaches are migraines.
Yeah. And I do have to say, unless you've suffered from migraines, like I've had to pull out of social events. I've been driving to things when the trails come on, which is kind of the blurry-eyed. And I've had to go home and missed a friend's 40th. And I think unless you know the pain, people are like, oh, she's got a headache, So I think it's really important for women to feel seen and heard when it comes to this.
I'm just asking for a friend.
So, my friends, they want to know.
It's not for me.
Hashtag just asking for a friend.
It's time for everyone's favourite. Dun, da, da, asking for a friend. Awkward health questions that we all know aren't actually about your friend, but we pretend they are anyway. Okay, today's question comes in from an anonymous listener. The plot thickens, Dr. Ginni. What have we got?
Hi, Dr. Ginni and Cath. Asking for a friend. I really am. This is not about me. Is wetting yourself actually normal? My friend swears it's no big deal, but every now and then she'll leak a little when she laughs, sneezes, coughs, or exercises. She's always assumed it's just one of those things that happens after having kids or when you're getting older, but now she's wondering whether that's actually true. And to be honest, so am I. How much bladder leakage is considered normal, if any? And at what point should someone stop putting up with it and get it checked out?
Oh, Anonymous, thank you so much for sending in my favourite question ever.
Oh, is it? I didn't know that. Is this your trivia section?
Yeah.
Pub quiz?
So good.
Okay,
Pub
let's
quiz.
go.
Can I just tell you, this is so common and no one talks about it. I agree with your friend. It is really, really common. And not just in women who've had lots of long labours. You can have had one cesarean and it happens to you. I've got friends who've never had kids and it happens to them. And let's face it, you've got a lot of stuff sitting on what is a very small muscle, your pelvic floor, and it gets stretched, and then you get a bit of menopause thrown in, and there's not enough estrogen sort of to tighten up the urethra, which is the little tube that takes wee straight out from the bladder out to the vulva, and it's expelled there. Men have got such a nice little design. There's a little kink, it goes down but then it goes up again, which means that gravity's on their side. For women, it's there is nothing to hold it in other than that pelvic floor. And if you have got extra stuff in your pelvis, let's say you've got a big uterus because you've got a fibroid. 70% of women age 50 have a fibroid. Let's say you're very constipated. Like Cath, that's another favourite topic of mine.
You love that topic,
I
poo.
love talking poo. And a lot of my patients have a lot of stuff sitting on their pelvic floor, clogging up their rectum. it all just puts pressure on that poor little pelvic floor, and she's not doing well. She's not doing well out there. And we all got told to do Kegel exercises after we had our babies. Did any of us do them? No. We did not.
I'm doing my pelvic floor doing it now while you talked about
honestly,
it. Panicking.
I only ever do this when I have this conversation and then I forget 10 seconds later. Like, we don't do it. And so the reality is studies show that pelvic floor physio can really help. The problem with real-world pelvic floor physio is, number one, no one's got time. Number two, no one does their homework because we're all so busy. And number three, we just put up with it because we don't talk about it and we don't go like, this actually sucks. I don't want my underpants smelling like a pub urinal. I don't really want to not be able to go do some sport in case I accidentally unload the entire contents of my bladder into my netball gear. Like, this is actually a really big problem, and especially if it means that you can't exercise, you don't drink. If it's
stopping you do things.
And it's stopping you drinking, and you now become dehydrated, we do need to address it. So, girls, this is going to be like a well movement. Can we talk about the pelvic floor? Can we just talk about it and the fact that we do need to be doing our pelvic floor exercises, that if you do your pelvic floor physio, if you address your constipation, if you deal with a massive fibroid if it's there, we can actually help you quite a lot. And it's not like the answer is either surgery or suck it up, princess. There is a world of stuff we can do between here and there to actually fix our pelvic floors and get you drinking properly again.
Okay, so what are we starting with? Pelvic floor exercises?
Maybe have a chat to your GP if you feel comfortable to see your GP about it, because you could even maybe get a chronic disease management plan to actually go to a physio and get some subsidy on Medicare for that. Let's just see what happens. But I think the more we talk about it and accept that this is now impinging on your life, your health depends on adequate hydration and doing exercise as you get older. If we talk about this, we can actually fix it.
Love this.
So, Anonymous, can we just tell your friend, let's get her off to the GP, that what she's experiencing is not cool, it's not okay, and we're going to actually work on her pelvic floor, and she's going to take it as seriously as any other health message, because this is going to impact her for the rest of her life.
Wow, you are so passionate about that.
Oh, poo, wee, vaginas, I've got all my passions.
I just love that. Okay, right, so we're all pelvic floor exercising right now.
Right now we are.
Okay, I've got another dilemma for you, Ginny. The question comes from 34-year-old Irene.
Hey, Irene.
Hi, Dr. Ginni and Cath. I'm 34 and I sleep 7 to 8 hours a night, but I'm exhausted all the time. I put it down to being a busy working mum, but lately I feel like I'm running on empty no matter how much rest I get. At what point does this tiredness stop being just life and become something worth getting checked out? Thanks.
You're there, Irene. You've written to us as well, and I think you are there. If you are getting 7 to 8 hours of sleep, and lucky you, I think it's because you're 34 and you haven't quite hit your peri stage yet, because once you hit peri, no one sleeps anymore. But I have some questions for you that I think you're going to need to take to your GP. Are you overweight, Irene? Now, this is not a do you look good in a swimming costume thing. I'm actually thinking about something called sleep apnea, which is underdiagnosed in women. And being overweight puts pressure on your upper airways and makes them collapse, particularly if you sleep on your back. Now, men snore like a train, and women pick up if they're in a heterosexual relationship, they pick up on their husband's snoring like there's no tomorrow. Nobody picks up on our snoring, Cath, do they? No, because men sleep through the night like a dream, and they don't notice that we're snoring, and if they do, they don't comment on it. I've never had a patient come to me ever and say my male partner says that I snore. Same-sex partners, different story. But yeah, this is the situation. We don't even know whether you snore, but we know that you can have sleep-disordered breathing, which will leave you in the morning waking up exhausted and just not being able to shake that exhausted feeling, often waking up with a headache. So often, without realising it, you clench your jaw in order to try and open your airways if they're collapsing at night. So that clenching can actually make you wake up with a headache. Waking up with a sore throat if you open your mouth really wide to try and inhale breath. And it's often a thickness around the middle. So you actually start to put on weight, but particularly that perivisceral fat that we were talking about earlier, so that belly fat. So if that's you, if you've put on a lot of weight and if you think that you could be snoring at night, if you're waking up with a headache or a sore throat, mention all of this to your doctor, because we can get a sleep study and get that diagnosed and fixed. Are you bleeding heavily every single month? Because iron deficiency can also make you bone-weary tired. A blood test will help pick that up. But can I just say there, too many women get an iron test, get their iron fixed, and no one ever says, but why has all your iron gone?
Yeah.
Having iron deficiency from heavy bleeding is not normal. We need to go and get that fixed as well. So we're going to investigate that. Do you feel really cold? Are you more constipated than usual? Is your hair really dry? Is your skin really dry? Could you have a thyroid problem? Again, your doctor will take a history, do an examination, but a blood test will be required. And then, it could be just a post-viral kind of syndrome that is happening around like after COVID, but even after flu, you can feel tired for months afterwards. They're the top sort of things that I'm thinking about, but you need your GP to go on this journey with you. But you need to book in today, Irene, or your friend does at any rate. If you're a little bit older, Irene, because you're 34, but if you're a little bit older, I'd be thinking, is perimenopause the driver here? Because literally 90% of my patients who are in peri are just so tired.
Yeah. Oh, well, we're not getting 7 to 8 hours sleep, though, are we?
No, we're definitely not.
So that's definitely not us.
Okay, if that is ringing true for you, Cath, I have just got the best news because Very Peri is here. It's been created by Mamamia. It's basically featuring 25 of the world's leading health experts, including me, because I am world leading, obviously, discussing exactly what you can do if perimenopause is basically getting on top of you.
That means no wait lists, no more 3 a.m. doom scrolling, just credible information. You can watch whenever and wherever you want. Head over to veryperi.com.au to get access today.
Okay, Cath, that's it from us.
Another app.
I know, it's so good. Guys, don't forget to follow the show just so you never miss an episode. Like, how good is it? You would not want to be missing this.
No thanks.
If you follow the show, it'll drop straight into your feed automatically. How good. And also, do make sure you're following us on socials to stay up to date with every madcap thing that we're doing, including all of the crystals in Cath's bra.
Love that. And if you want to hear your asking for a friend question, send us an email or voice note to well@mamamia.com.au. And we, and by we I mean Dr. Ginni, will get to the bottom of it. And please remember, information discussed in this podcast is for education purposes only and is not intended to provide professional medical advice. Please seek your own medical advice specific to your circumstances from your healthcare professional. See you next time.
And stay well.
Mamamia acknowledges the traditional owners of the land we've recorded this podcast on, the Gadigal people of the Eora Nation and the Wanneroo people. We pay our respects to their elders past and present and extend that respect to all Aboriginal and Torres Strait Islander cultures.